And now I'm more than happy and welcome to Dr. Foz to come to the stage. Thank you so much.
Thank you.
How are you doing? Now, this scientific session explores the evolution of intimate aesthetic medicine toward a more functional, anatomical, and regenerative approach. Beyond moving the concept of cosmetic correction, the discussion will focus on tissue quality, collagen stimulation, vascularization, anatomical preservation, patient selection, and safety in feminine intimate procedures. Particular attention will be given to how regenerative biostimulation can be integrated into clinical practice through correct indications, anatomical knowledge, individualized protocols, as well as case-based evaluation. The session is designed for physicians interested in a medically rigorous approach to intimate regenerative medicine, combining aesthetic outcomes, functional improvement, and patient-centered care. I'm honored to have you, Dr. Foz.
Honor is mine.
Do you want to tell a little bit about yourself?
As I said already this morning, I'm Dr. Foz. I studied in Rome Sapienza. I'm a dermatologist, and also KOL speaker and international trainer for many companies, but basically focusing on biostimulator.
Excellent. And today, the field is moving beyond purely aesthetic correction toward a more anatomical, functional, as well as regenerative approach focused on the tissue quality, patient safety, and long-term clinical outcomes. This does require physicians to combine precise anatomical knowledge, careful patient selection, ethical communication, as well as evidence-oriented treatment planning. To explore this emerging area of regenerative feminine medicine, I'm so honored to have you. And our first question, Dr. Foz, is that in recent years, intimate aesthetic medicine has moved from purely cosmetic procedures toward regenerative and functional approaches. So tell me, what is driving this clinical evolution?
So, intimate aesthetic, it's been there for a long period of time, but in recent years, as a study done with the Society of the American Plastic Surgery shows, actually 20% increase of the intimate aesthetic surgically and also non-surgically. So that's why it's a new focus and highlighted also in the aesthetic medicine, especially for non-surgical procedures.
Thank you. And when treating the intimate area, anatomical knowledge is essential. Which anatomical structures and tissue layers should physicians always consider before planning a regenerative or biostimulatory procedure?
So basically, as we already know, as medical doctors, anatomy is very essential and important, also in the intimate area, because so many doctors, they believe anatomy of the intimate area and vulva is so simple, which is not true. We also having the arteries and vein, that's very important. So knowing your anatomy for having the best result is very important. But regarding the using biostimulator, especially in intimate area and the other part of the body, also face, the layer of the injection is the most important to know, so you're gonna end up with a good result and actually getting more collagen biostimulation rather than making scars, which we were talking about it all day.
Exactly right. Thank you. And from a biological perspective, Dr. Foz, what is the rationale behind regenerative biostimulation in feminine intimate medicine?
So as Dr. Sharma already said, there is a direct connection between the estrogen declining and losing collagen, especially collagen type 3 in all over the body and also in the intimate area. And that's where the biostimulation or biostimulators hit in. Because the purpose of the biostimulators is producing or regenerating collagen, especially collagen type 3. And as a biostimulator, just to be highlighting it, what is it? There are basically two different main type of biostimulators. One is a CAHA, calcium hydroxyapatite, and the other one is a polymers of PLA. So the point of using the biostimulators in face and also in the intimate area is producing collagen. And why is it important? Because as already Dr. Shabnam said, we losing lots of collagen after, especially after the age of 30. And in this kind of, in this era that we are hitting in, it's not only menopause or menopause and aging, also over-exercising and using GLP-1 products like Ozempic. I don't want to say the names, but I know that most of the doctors, they are already familiar with. Using that kind of product also leading to lose so much of the collagen.
Excellent information, thank you. And so which patients are the most appropriate candidates for regenerative intimate biostimulation, and which clinical situations require caution or even exclusion?
So we are here we are talking about the aesthetic, okay? And for sure, the patient desire is very important, but sometimes also doing non-surgical filling of the vulva can help pain and sexual intercourse also. Beside that, taking a good history from the patient is very important, because not all the biostimulators can be used for all the patients. Like having some history of chronic inflammatory diseases is crucial for not using your PLA. On the other hand, you can use your CAHA or calcium hydroxyapatite for that kind of diseases. So knowing the history of the patient is very important.
Exactly. And beyond visible aesthetic improvement, which functional outcomes should physicians evaluate when treating the intimate area?
As I already said, basically, especially non-surgical vulva or labia is not like a surgical labiaplasty. Mostly we are focusing on the laxity, but also it could help a little bit with the function and especially pain. Okay.
And so as a trainer, what are the most important skills physicians must acquire before performing any intimate regenerative procedures?
Anatomy.
Exactly.
I believe so that most of the doctors, they should do at least once the cadaver training for the face and also for the body, because knowing the layer, especially as using the biostimulator, is very important and crucial.
It's crucial.
So doing a training, especially hands-on training, it's a main factor to end up with the good results, and also inhibiting the complications.
I agree with you 100%, thank you. And how do you see the future of regenerative feminine wellness within aesthetic and functional medicine?
I think it's growing, and I'm so happy that finally women, they start to think about themselves and not only raising the kids or maybe living their life. So focusing themselves, it's helped a lot with also with the psychology and living their life happily. So using the devices, also the Endolift or other RF devices beside the biostimulators, HA fillers, fat and PRP and exosome, they're gonna have a big role in the future aesthetic.
Excellent, yes. And what is the most important message, Dr. Foz, that physicians should remember when approaching intimate regenerative medicine?
I believe so. It's very important to know that intimate area, it's not as easy that they think. And there is so much anatomy behind it. And choosing the right products, the right patient, is very, very important to ending up with the good results.
I'm so grateful for the work you've put in, and this has been an incredible conversation, so thank you.
Thank you so much.